Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. A welcome this afternoon to our guests. As always, we're joined today by the Mayor of London, Ed Holder, the Warden of Middlesex County today, the Warden of Middlesex County all the time, Cathy Burghardt-Jesson, and the Middlesex-London Health Unit's Medical Officer of Health, Dr. Mackie. A welcome to the media this afternoon. We're glad you could be with us as well, and look forward to having your questions. We know that there are already several that are in the queue waiting to go, but if you haven't put your question in, just use the question form here on Microsoft Teams. Click on the text box with the question mark, indicating your name, your media outlet, and who your question is for. Also this afternoon, we'd like to welcome those who are tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are joining us on the CTV London website. Let's get to the opening remarks right away. We'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. Like everybody else, we're anxiously awaiting word from the provincial government on what kind of restrictions London Middlesex will be facing when the stay-at-home order is lifted on Tuesday. I'm anticipating that we'll know this by tomorrow, and I'm hopeful the announcement will provide Londoners and London businesses with some much-needed relief. As someone with family involved in running a small business, I can tell you I empathize deeply with everyone who continues to be impacted. You know, from the start, businesses have done everything they've been asked of them, often on very short notice and at significant expense, while constantly adapting to ensure members of the public are kept safe from COVID-19. According to the available data, businesses are not responsible for the level of spread we've experienced, but it is they that wind up bearing the brunt of the consequences. Regardless, though, of whether we find ourselves in the orange tier or the red tier, we should all take comfort and great pride in how we've managed to bring our outbreaks from December and early January under control. You know, we've gone from daily case counts nearing 200 down to around 20 per day recently. Our percent positivity is dropping, our hospital capacity is improving. Your efforts are making a difference. Your efforts are saving lives. They're also buying our healthcare system and public health officials valuable time as we continue to vaccinate our most vulnerable as fast as we possibly can, given the limited supply of the vaccine. While our circumstances will change next week, our commitment to these efforts must not. It's absolutely critical we continue to follow public health guidelines if we want to keep each other and our economy healthy. So, thanks, Londoners. You are truly making a difference. Now over to you, Warden Cathy.
Well, great. Thanks so much, Mayor Ed. It's great to be with everyone this afternoon. I cannot let today go by without acknowledging the significance, especially for one of the members of the team on the call today. Today is National Guitar Day, and I know for a fact that for Dan Flaherty, it is especially meaningful. Perhaps Dan should have opened the briefing with a tune. We all know how talented he is. Monday is, of course, Family Day. And although given how much time we have spent with our immediate families, one could argue it has been family year. That being said, we have to acknowledge that there have been many sacrifices made by all of us over the past year. We have been asked in so many ways to limit contact with family members outside of our immediate household. I have shared with you in the past how I've only seen my sister once since January of 2020. And my heart, quite frankly, aches for the day that I can see her and hug her and hold her hand. And I know that we are all anxiously waiting for the day when our family circle can be opened up. So I ask you to celebrate family on Monday, but please continue to do it virtually or on the phone. Do not tempt fate and get together. Every day, every week, we get closer to larger bubbles and family get-togethers, but only if we can continue to do what is asked of us. With the news earlier this week that our stay-at-home orders will be lifted, I think we can all feel cautiously optimistic about moving forward. The hard work of our residents is paying off, and I think we can all agree it has not been easy. As restrictions begin to ease, I want to ask those in the county to ease into being out and about as well. We cannot get complacent. We still have to be mindful of how we go about our daily lives. So continue to plan your strategy. Now, if you're like me, you likely want to shop for something in person besides groceries. And as small business retailers and services begin to reopen, now is a good time to encourage county residents to support the retailers and services in your communities. Our retailers and service providers across Middlesex have done such a great job in pivoting to new business models, doing what has been asked of them in an effort to continue to keep their business going. When doors can be opened and appointments made, please find a way to support those businesses in your community. With this in mind, I do want to take a moment to congratulate the team in the Economic Development Department of Middlesex County. Yesterday, they received the Economic Developers Council of Ontario 2020 Tourist Attraction and Tourism Product Development Award for the creation of the Middlesex County Culinary Guide. It's a guide that shares the amazing flavors from across the county. And it could not have been successful without the partnership of the Middlesex-London Food Policy Council, the Middlesex Federation of Agriculture, the Tourism Industry Association of Ontario, FedDev Ontario, and most of all, the Middlesex-London Health Unit. It really was a team effort. Most of all, I want to thank everyone who has used the guide as their map to continue to support local businesses in our area. This guide and the support shown for it shows us that together we are Middlesex strong. And on that good news note, I'll hand it over to Dr. Mackie.
Well, thank you very much, Warden Burghardt-Jesson and Mayor Holder. As always, your remarks are deeply appreciated. Particularly your shout out to our good communications officer on Guitar Day. The cases continue to trend downward, although we seem to be leveling off a bit at the local level. 24 new cases today, one fatality, a woman in her 90s, and that seems to be flattening off here. Across the province, you're continuing to see declines. We're still per capita lower than the province, but the province is dropping in the direction of the case counts here. So all in all, a pretty good news picture. I do want to point out one change on our dashboard this week. We have begun to report resolved cases in the same way that the province has, rather than recovered cases, which we had been reporting before. A number of people have pointed out discrepancy in the provincial versus local numbers in that recovered versus resolved category. That's because they are different things. Those cases that are resolved include cases that, for example, have passed. And so, of course, that's not the same count as those that have recovered. So you'll see greater alignment in the data. We're always off a little bit because of that lag. We report all cases that come in the previous day, whereas the province reports cases that come in the previous day only until about 4:30 when they do their data pull. So it's always a little bit different, but the resolved cases will start to look more similar on our dashboard. With that, Dan, I'll pause and take any questions. Thanks.
Thank you very much, Dr. Mackie, Madam Warden, and Mr. Mayor. Well, yes, we do have a lot of questions, and why don't we get to those right away? So I'm just going to head up to the top. Here we go. Jennifer Beeman is the first in line today with our questions. Dr. Mackie, Jen's question is for you. Dr. Mackie, are you expecting local cases to increase as the province-wide shutdown is lifted next week?
Good question, Jen. I think that there are a few things that we have to consider when we look at the impact of public health measures like the province-wide shutdown. One is the actual impact on people's activities in terms of the regulation. Two is the message that it sends and how people carry that message into their day-to-day lives. Opening up to red level restrictions would not increase risk substantially in our lives in and of itself if people are following the restrictions to the letter and continuing to avoid indoor gatherings as recommended. The big question is whether that change back to the color-coded system will be a signal to the public that is used beyond what is actually in the regulations to guide people's activity. So if people are thinking that, the province is opening up and we should get back to normal next week, or that it's okay to, host large indoor gatherings as of next week, that is definitely not the case. And if people are thinking that we will see cases jump. If we're still able to keep our distance and avoid indoor gatherings, then the move to the color-coded system shouldn't have a big impact on cases at all.
All right, thank you very much, Dr. Mackie. Let's go to a follow-up question from Jen Beeman. Dr. Mackie, some infectious disease experts are warning of a third wave as soon as April due to the spread of more contagious variants. How concerned are you about variants locally?
We are definitely concerned about variants locally. We have had variants locally. We've documented spread locally, and we're definitely concerned about what the impact will be over the next few months. We do not have a lot of spread of variants of concern right now. We don't have any active cases, for example, that are variants of concern. But we know that in places where the variants have begun to come into the picture, they do take over and they do start driving illness rates. And so that's something we're all going to be watching closely. And it may mean that we need more restrictions in the next few months. It's not what's happening right now. And so that's why you're seeing some of those restrictions being lifted. But it could be within 1 to 2 months it become a more important factor of what's happening in the pandemic.
Dr. Mackie, let's go to another question. What we're going to do is, Jen, I know you've got some more. We're going to come back to those. So we're going to jump down to questions from Wendy Spence, joining us from the Dorchester Signpost this afternoon. Dr. Mackie, have you had any indication of when the province will announce what color of the framework that the Middlesex-London area will be placed in on Tuesday?
Yes, did have a conversation with the Chief Medical Officer of Health about that this week. When you look at case counts as the most important factor determining where our community will end up, we're very close to the border between orange and red, just strictly by case counts. The other factors, reproductive number, percent positivity, are somewhat biased in our situation, so I wouldn't consider them major drivers of that decision. Hospital capacity is holding up, public health capacity is stretched at the moment. So those are all the sort of factors that the province looks at in making that decision. The conversations with Chief Medical Officer of Health have been deemed confidential, so I can't go into detail there, but I can tell you that we're right at that border from a data perspective. What will happen from there is the Chief Medical Officer of Health advises Cabinet, and there should be an announcement either later today or tomorrow about which direction our community is going.
Thank you very much, Dr. Mackie. Let's go back to a couple of questions from Jen Beeman. Dr. Mackie, is the Health Unit launching asymptomatic testing at Clara Brenton Public School in response to the outbreak there? Why or why not?
Yeah, so the asymptomatic testing has some downsides, especially around sensitivity and specificity. So that you get a lot of false positives and you get a lot of false negatives. So we don't see it being useful at this stage. If there is additional spread at Clara Brenton that really seems unexplained, that is in excess of what's happening in the rest of the community, that could be a trigger to do some asymptomatic testing. But we don't see it being useful now. We've also had discussions with the health units that have used the PanBio, which is the rapid test that's being offered for asymptomatic testing in schools, and they found a lot of issues with doing that sort of screening. And so they are not recommending it and are not planning to use it extensively in their areas either.
Thank you very much. Folks, if you have been waiting to submit your questions, if you are a member of the media who's online with us this afternoon, now would be a good time to put that question in. We know there's a little bit of a delay on Microsoft Teams, but we are getting down to the last few questions. So if you did have a question you wanted to submit, now would be the time to click on that question button. Let's go to another question. Dr. Mackie, do you have an update on the number of cases linked to the outbreaks at EMDC and the Men's Mission? This is again from Jennifer Beeman at the London Free Press.
Yeah, so things have really calmed down at both of those sites, Jennifer. Over the last couple of days, we haven't got any new cases today from either site.
All right. Let's go to another question from Wendy Spence at the Dorchester Signpost. This is good. This is optimistic and looking forward, I think. Dr. Mackie, do you know what the requirements are for restrictions to be lifted completely so life can get back to pre-COVID normal? Is there a number of cases, vaccinations, or deaths?
It's a great question, Wendy. That has not been discussed at the provincial level. We don't have set levels at which we'd really get back to absolute normal. You can look to the color code framework and the cutoff levels there to get a sense of where we would need to be from a case count perspective. The green level, which is pretty minimal restrictions, requires less than 10 per 100,000 per day. Per week. We're at the range of about 40 per 100,000 per week now, so we've got a ways to go there. But beyond that, getting back to a place where there really are no restrictions whatsoever, including, for example, no more requirements of masking, that's really a long-term question. I would see that being out in the range of 6 months or more from now. So there's a lot of more information that's going to come into the picture between now and then. We'll know more about what's going to happen with the variants of concern. The other thing I would point to is we have, once again, another week of 0 cases from an influenza perspective. So the things that we are doing, we will not keep up all of these restrictions long term, but they do have health benefits in terms of preventing the spread of infectious disease. And that's something that I think we'll want to think about as we define what the new normal is. Do we accept people coming to work sick anymore? Do we use masking more when we're in public transit, for example, than we have in the past? These are questions that I think we need to wrestle with as a society and also as individuals. Many of us will probably carry some of these practices forward, even if they don't end up being absolutely required.
Certainly, it's hard to look into the crystal ball at where we will be in 6 months to 8 months to a year. So we appreciate the question, Wendy, very much. Let's go to our next question. Another one from Jennifer Beeman. Dr. Mackie, has the health unit just had the 2 variant cases, the recovered man in his 80s from December and the deceased close contact?
Yeah, we have had additional cases from that same cluster. So the individuals that were in close contact with those 2 cases, we've tested as well. We've now documented 5 positives altogether. Those are all from that same cluster back in December. We don't have any more recent variants of concern that have come back positive. As you probably know, the province is now testing all positives for variants of concern. So they're not testing every sample, but when a sample tests positive, they will go on and do secondary testing for whole genome. Well, there's a SNP test, which looks for the 501 mutation, which is part of those 3 variants of concern, Brazil, UK, and South Africa. And then they also do whole genome sequencing. And together those tests take another, 7 to 10 days. So those won't be tests that are available in real time to control spread of outbreak. It's more about documenting what's happening across the province to know how big of a factor variants of concern are here to help to establish a stronger trending and modeling about what might be there to come.
Thank you very much. On to the next question. Jane Sims from the London Free Press has sent in a question. Dr. Mackie, lots of parents are asking what the issues are with the PanBio tests. Can you be more specific?
Yeah, the issue with the PanBio test is mainly that it's not as accurate. So it's only a range of 50 to 80% sensitive. So that means it misses 30 to 50% of cases. That means a student could test negative on the PanBio and still have COVID, and potentially be less cautious than they should in a given circumstance. And then there's the false positive, which then requires a PCR swab to confirm. So the false positive we do handle from the perspective of doing that gold standard test. So people don't go into isolation because of a false positive. There is a confirmation that happens, but that's takes time. It's a logistical challenge, and so there's real downsides there. The other thing to note, we are doing lots of testing. When a case comes back, everyone in that classroom is recommended to go for testing, whether the case is in the student or in the teachers. So we do know whether there's spread or not happening in a classroom when there's a positive, and that's the most important question. The issue with the false positives and false negatives has been the biggest challenge from the perspective of the health units that have used the PanBio in their schools.
Thank you, Dr. Mackie. And yeah, that's actually a really great point. When we have seen those cases in classrooms, everybody in that classroom, symptomatic or not, and in most cases not, they are going for that testing, that PCR, as you mentioned, gold standard test. So thanks for the question, Jane. Jennifer Beeman is in with another question. Dr. Mackie, how far along are the second doses for long-term care residents?
Yeah, so from the perspective of the number of residents of long-term care and retirement homes, we're over half finished. From the perspective of the total number of homes, we're about halfway through. We did target the larger homes first in partnership with staff there. So we have more than half of those individuals who have received second doses. All of that wraps up next Wednesday. So we're basically on the same kind of 2.5 week schedule that we were last time around, and those will wrap up next Wednesday. And then hopefully we get green light soon to be able to start offering additional first doses to retirement homes that have not yet received the vaccine because they've been deemed to be lower risk.
Thank you very much. Question. Jane Sims does, she enjoys the briefings very much, and she's got a great sense of humor. And she did submit a question, and I'll just let everybody know, Dr. Mackie, she was hoping you could answer the question again, but this time if you could sing the answer. And I don't think we have time for that, unfortunately, but thank you for the question, Jane. Actually, what I'm looking forward to is Jane, in her column today in the London Free Press, wrote her own sea shanty lyrics, and I do look forward to the time when we will be able to hear that song performed. So that does bring us to the end of the questions today on our virtual media briefing. Thank you for joining us. We really appreciate it. And a quick reminder that for next week, because it's Family Day on Monday, we will not be having a virtual media briefing on Monday. Instead, we will be having it on Tuesday. So next week's virtual media briefings will be happening on Tuesday and Thursday. And just as I was mentioning, we did get one question come in under the wire, so we'll take that. Wendy Spence from the Dorchester Signpost is in with one last one. Dr. Mackie, what are your thoughts on delaying March break until April 12th?
I appreciate the question, Wendy. There are clearly advantages and disadvantages to delaying March break. From a COVID perspective, if you delayed March break to a time when the weather's going to be better, you potentially aren't going to get as much indoor congregation of people, visiting with family, friends, and potentially traveling. They could do that outdoors, and potentially it's a lower risk situation. April weather isn't necessarily predictable, so that's certainly not a guarantee. The other side of the coin is the March break is something that teachers and families plan for as well, and there are mental health benefits to that, taking that sort of break. So, and then on top of all that, there are educational issues. So, I certainly have spoken in support of delaying March break from a COVID perspective, recognizing that there are other considerations to take, and that the government, as they make the March break delay decision, will have to take multiple perspectives into account, not just infectious disease, but also mental health, wellness of teachers and children, and also, the educational impacts of doing so. So I don't think public health is the one that should be making that decision, but I do see the benefits from a COVID perspective.
Thank you very much, Dr. Mackie. And actually, as you were answering the question, an alert just came along the wire that the province has put that delay in place to delay March break until April the 12th. So some breaking news this afternoon on our virtual media briefing. That does bring us to the end of this afternoon's briefing. So again, thank you very much for being with us. Mayor Holder, Madam Warden Burghardt-Jesson, Dr. Mackie, thank you all for your insights, for your time, and for being part of this public discussion. We will see you next Tuesday for the next virtual media briefing. So between now and then, have a great rest of the day, have a great weekend, and we'll see you next week. So long for now.